Hello and welcome to Let's Talk Mindcare, a podcast brought to you by MindPath Care Centers. MindPath is one of the largest outpatient mental health organizations in the Southeast U.S., with over 25 locations and more than 180 providers. For the past 25 years, we have helped tens of thousands of patients across North Carolina, and now we've created this podcast to further commit ourselves to ending the stigma and continuing the conversation around mental health through discussions with real mental health professionals. Please note that while the podcast will include accurate information with professional input, it is not intended as a replacement for medical advice from licensed providers. To receive such advice, please contact MindPath Care Centers at mindpathcare.com or call us at 877-876-3783, and we will connect you with a professional who can further assist you. We hope you enjoy the episode. Hi there, my name is Trent Brown, and I'm one of your hosts for the Let's Talk Mindcare podcast. I'm joined today by Julie Killion, one of our wonderful licensed clinical mental health counselors. Julie, if you want to take the floor, just tell us about your background and why you became a mental health provider.
Absolutely. So my background, I have a bachelor's in psychology and a master's in clinical mental health counseling. I'm a licensed clinical mental health counselor, a licensed clinical addiction specialist, and a national certified counselor. I have worked with adults and children in outpatient settings, inpatient settings, and emergency services, treating both mental health and substance abuse disorders. So I first fell in love with psychology in high school in my AP Psych class. I find humans fascinating, especially how our brains work. I absolutely love my job, and it's really an honor to be able to walk with people on their journey of changing their life. It's so very rewarding.
Yeah, definitely. I can imagine. Just being a part of this organization and getting to meet, you and a bunch of other providers. Everybody seems like, super grateful that they get to, be a part of someone's journey to feel better and everything. It's awesome.
Absolutely, yes.
Yeah. So we're going to keep these questions pretty simple. I kind of just want to talk about, for people who don't know that much about therapy and, mental health counseling and things like that, just kind of talking about what the simple things of what happens and everything. So my first question is, can you kind of tell us what happens in a first session and, what a person can expect from therapy?
Sure. So the first session is what we call an assessment or an evaluation. First, just like with anything, you'll fill out some paperwork with your basic information and then agree to participate in the first session. What also happens is before getting started, you are informed of confidentiality. That's a really big thing in therapy and its limitations, just so that there are no surprises before getting started. Then we listen to your story and ask a bunch of questions. We want to know why you decided to schedule the appointment, get your history, learn about what you would like to work on, and things like that. It's really important to know, too, that this is also a time for the client to get to know the therapist. So during the first appointment, I tell clients who I am, what I do, and what they can expect in a therapeutic relationship with me. Then if a client decides to pursue therapy with me, we talk about how often, how to contact me, basic housekeeping, things like that.
Yeah, definitely. Awesome. So kind of taking a short step back before the first session, could you tell me any tips, if someone is anxious about making an appointment or after they've made the appointment, if they kind of have some jitters around their first session, some tips to help that?
Absolutely. So most people are nervous about the first session. That's totally normal. Remember that the first appointment is just getting to know each other. So this includes not only the therapist getting to know the client, but also the client learning about the therapist and what you can expect from therapy. It's really a time for you to ask questions and address any concerns that you might have. It's really not a dive in to, deep therapy. It's just getting to know each other, questions, things like that. A good tip is to write things down. If you think that you'll get nervous and forget an important question, important concern, or just forget to bring up something in general, then writing it down before the session can be really helpful. Um, Also, it's important to know that we've heard it all. There's nothing that you're going to say that's going to surprise us. Our job includes helping people navigate all sorts of difficulties, so chances
Hmm.
are it's not the first time that we're helping somebody deal with a particular issue.
Yeah, yeah, definitely. And no, I can say, I mean, I think it is really helpful to kind of understand that the first session is really, a getting to know thing, and you can kind of feel it out when you're there, whereas, you don't feel like you're taking on something so huge.
Exactly.
Yeah, awesome. So you've kind of talked about it a little bit, but could you tell me a little bit about, what a person should think about when they're looking for the right provider, and about finding the right person to help you with your journey?
So I encourage everyone to do a little bit of research before choosing a therapist. So at MindPath, we have a really great website where all of our providers have a short bio and they have their specialties listed. You really want to make sure that the provider you choose seems like somebody who'd be able to meet your needs. So, for example, if you're looking for a specific type of therapy, which some people are,
Hmm.
like dialectical behavioral therapy. You want to make sure that the provider is actually trained in that modality before scheduling an appointment. You
Yeah.
can always call the therapist or you can call the intake department to check on that. But that's a really good first step about finding that right provider. And you may not know what you need, and that's fine too. But if you have an idea, just making sure that the therapist specialties matches up with that. And once you have scheduled the appointment and you have the first session, the next advice I usually give to people is to make sure you actually like your therapist.
Hmm.
Not all personalities are going to click, and that is totally okay. It's perfectly fine to shop around for a provider who is a great fit for you. You want to feel completely comfortable with that person in order for therapy to be the most effective. So if you have that first session and you're really like, yeah, I don't know if this person is offering what I'm looking for, or I don't know if I'm completely comfortable with this person, that's okay.
Yeah.
It's really fine to address those concerns and then look for another provider. That's something that a lot of people aren't aware of.
Awesome. Yeah, yeah, definitely. And I just want to add, you talked about it a little bit, but
Mhm.
if you're listening to this and you're curious about our website, and searching for someone to be your therapist, or a provider for you, if you go to our website and you go to the find a provider thing, we have everything listed from, if you want an in office person or telehealth. We have locations, whether you want medication management or therapy, insurance, age selection. We have so many different things, and we even have a page that specifically says, what type of provider do you need, and kind of talk you through what some of what Julie just said. So if you're looking for a psychologist, or someone like Julie who is a licensed clinical counselor or something like that, we have it all listed on our website. Um, so yeah, yeah, yeah. So another question, and you've talked about it a little bit, but if you could expand on, when you're in the first session or the second, all the way through however many sessions, what do you do as a provider to kind of try to make someone feel more comfortable in a session?
Personally, I try to not use very many clinical terms in the first session and throw a lot of, I guess, what they would call psychobabble at you. I really
Hmm.
strive to make it comfortable and casual because I know how unnerving it can be to tell all of your business to a stranger. Um, Something else that I try to do is I try not to take very many notes during the session. I really want it to feel like a conversation. and because it is, and
Mm-hmm.
I want to convey that the client has my full attention because they do. And I don't want to be at my computer taking notes the whole time and, not making the eye contact and not having it be um, a fluid conversation like it should be. That's a really main thing that I like to do, especially
Mm-hmm.
in the first session. Also, I usually let the client tell me what they feel is important. I really believe that the client is the expert on their own lives, and I might be the expert in psychology and mental health, but the client's the expert in their life. So I let them tell me what they feel is important, and then I just interject questions as needed. I have so many people tell me that it feels so good just to let it all out and actually be listened to and their
Yeah.
concerns validated. That's such an important part of therapy. And that can definitely start just in the first session by you coming in and it's like, what's bothering you? What's important to you? You tell me and we'll go from there.
Yeah, that's awesome. Yeah, yeah. Thank you for sharing that. Um, yeah, I think that is it's I mean, just for me even, it's awesome to hear. I've met quite a few of our providers at MindPath, and I've met providers that are at other places in the past too. And I think it's really important to remember that providers are people, and then they're trained to do this really well, and they're trained to listen to you and kind of just to be there along with you on this journey and help you get there. Um, so when you have that anxiety about it, I think it's really important to remember that providers are people just like Julie that are really just here to help you out. Um, so Julie, I think I've asked all of my questions, but is there
Mhm.
anything that I've missed that you want to add?
Well, actually, you kind of just touched on it. I was going to
Mm-hmm.
say, remembering too that um, we're humans too. We just happen to have a specialty in mental health, but we're humans and we're not the expert on everything. And we are just here to help you navigate whatever it is you're going through. And our job is to not provide any type of judgment and just to provide that unconditional positive regard and walk with you through whatever you're going through.
Very awesome. Very awesome. Well, thank you so much for joining us and sharing all of this.
My pleasure. Thank you.
All right. Thank y'all for listening.